Hi, I'm Dr. Elizabeth Hesse-Sheehan with Experience Health. My website is oneextraordinaryjourney.com. Today I'd like to talk a little bit about the thyroid and hypothyroidism, specifically in the Down syndrome community. The thyroid is a butterfly-shaped gland that sits in the throat and makes thyroid hormones. Thyroid hormones are important for a wide variety of biological activities. They have influence on energy, metabolism, the heart, the lungs, and the gut, just to name a few. There's a very big issue with hypothyroidism or subclinical hypothyroidism in the Down syndrome community that is often not acknowledged and not addressed by traditional medical community, even quote unquote Down syndrome specialists. What will happen is a doctor will run a TSH and maybe they'll add another thyroid test called T4. TSH is a pituitary hormone. The pituitary is a gland in the brain that signals organs like the thyroid, the adrenals, the ovaries, or the testes to make hormones. So TSH is not actually a thyroid hormone, it's a pituitary hormone. T4 is a type of thyroid hormone that is inactive. It then needs to be activated into T3. This activation or conversion happens in the thyroid, but it also happens largely outside the thyroid, in the liver and the gut and the kidneys. Certain nutrients are required to make that conversion happen, things like vitamin A, selenium, iodine, zinc, and iron, just to name a few. So what happens is the doctor will run a TSH and a T4. The TSH will typically come back elevated. The reference range will often be between 0.5 to 4, 5, or even as high as 6. Your child may come back with a TSH of 5, or 6, or 7, or 10. The T4 many times will appear to be normal, and your doctor will tell you that your child's thyroid is fine and does not need treatment. I feel this is very mistaken. In general, I like to see the TSH around 2. There's a lot of talk in our community about the closer to 1, the better. I don't necessarily agree with that. It kind of depends for me on what's going on with the bigger picture. As a holistic doctor, I look at everything holistically, look at the big picture, and correlate lab findings with clinical presentation or the symptoms the patient is experiencing and other findings in the labs and other findings in the body. The problem with running a TSH and T4 is that it does not give the whole picture of the thyroid. We need to see what's going on with free T3 and another hormone called reverse T3. Because what happens is T4 gets converted into either free T3 or reverse T3. Thyroid conversion will be shunted towards reverse T3 in certain situations: periods of stress, periods of chronic illness, certain nutritional deficiencies, and other imbalances in chemistry. The medical profession is not highly on board with running reverse T3. They feel it's a useless test, or a child with Down syndrome is not sick enough to run reverse T3. I don't know about you, but to me, a child with Down syndrome, a chronic neurological condition, qualifies as A, being in a stressful situation, and 2, having a chronic illness or health challenge. My experience over the last few years with running thyroid panels specifically in the Down syndrome community is that many times TSH can appear normal, even T4 and T3 can appear completely normal, and reverse T3 will still be highly elevated. What happens when reverse T3 is elevated is the body is making too much of this inactive T3 hormone. Free T3 is your active thyroid hormone. Reverse T3 is an inactive thyroid hormone. So what can happen is elevated reverse T3 means the thyroid hormone receptor sites on the cells are being blocked from free T3. So even though lab numbers look good, your child can still be experiencing hypothyroidism. That's why a full thyroid panel at the minimum is important to assess thyroid. So that's going to be a TSH, either a total or a free T4 or both. A free T3 and a reverse T3 is the bare minimum for a thyroid panel. If your child has not had antibodies done to screen for autoimmune thyroid diseases, that's the thyroglobulin and the thyroid peroxidase, those two also need to be done at least once. For me, as a holistic doctor, thyroid is always more than just thyroid because things like methylation impacts the thyroid. I want a CBC to kind of screen for folate, B12, B6 deficiencies, those particular vitamins that are especially an issue in Down syndrome, and make sure that methylation is okay and not impacting thyroid. Liver is another important thing. If the liver is stressed, that will impact thyroid. Adrenal status is an important key part as well. If the adrenals are stressed, that impacts the thyroid. So especially TSH. So you may have an elevated TSH and normal thyroid numbers, including reverse T3, and it's not a thyroid problem, it's an adrenal problem. We'll talk more about adrenals in another video. Iron and iron studies need to be done. Sometimes you also want to do serum testing of the cofactors that help with thyroid conversion, zinc, selenium, iodine, vitamin A, those types of things. Because we want to do is make sure that we are covering all of the nutritional bases that help support thyroid health. But with Down syndrome, we also have to look at the genetic pieces. One of the genes that's overexpressed in Down syndrome, DYRK1A, has a role in thyroid health. Now, with TNI, we use EGCG or green tea to help regulate that particular gene. There are also things in Nutravene that can help support thyroid. My overall experience, though, has been mostly that even if you're doing the full TNI protocol, a lot of times thyroid and adrenals, liver, gut, oftentimes still need to be supported. Do you have to use medication if your child is hypothyroid? Not necessarily. My son Connor, who at the time of this recording is about 2 years, 8, 9 months, something like that, almost 3. We got his first set of labs back 2 weeks after he was born, and that's when we got our Down syndrome diagnosis. His TSH was well above reference range. It was in the high 20s to low 30s, and his T4 was elevated as well. So a medical doctor is going to take one look at that and say, well, we can't treat him with thyroid hormone because his T4 is already too high. For me, that was not an option. And because I'm a holistic doctor, I have a huge bag of tricks. So I immediately started him on an herb to help support his thyroid, an herb that I have a long-standing track record for using with hypothyroidism and adrenal issues because it works on both. And I knew with this particular herb, no matter what was going on with TSH and with T4, it would start to regulate it and give me some time to figure out what other tests to run and what other treatment options to look at for him. So this entire time, Connor has been getting his thyroid and adrenals supported and treated herbally. At one point, his reverse T3 has spiked up, and I just kept him on his protocol because that's what he energetically tested for, and made sure I was dosing him appropriately because in Connor's case, I had started slacking and dosed him 2 times a day instead of 3 times a day. And for him, that made all the difference with his thyroid numbers. And once I got him on the right dosing schedule, his reverse T3 came right back down. Every child is different. Every child is going to respond different, and every child has a unique biochemistry that really needs to be evaluated and worked up for the best possible outcome. For me, I'm really trying to see if I can manage his thyroid without doing medication. The reason for this is once medication is on board, it's very hard to get off of it. And once a thyroid medicine is in the picture, it's going to have some type of effect on the rest of the endocrine system. Maybe not a big effect, but it will have some effect. With the herbs, they are going to serve more to help actually support and balance his entire endocrine system. So that's why I'm going with that approach and seeing if it works. I evaluate Connor every 4 to 6 months with the labs, make sure his numbers look good, redo his energetic testing, and if down the road sometime I need to put him on medication, I am open and willing to do that. But for now, he's doing good with the herbs, so that's what we're sticking with. Many doctors are resistant to ordering a full thyroid panel, so please know that going into it and realize that you may have a bit of a fight on your hands and you're just going to have to really push the issue or work with a doctor that is willing to order the labs for you, and that may mean having to pay out of pocket for them, which is unfortunate, but that's the reality. I've seen way too many kids that appear to have great thyroid labs, but that reverse T3 is not being done, and that is a big part of the issue. As you know, there's a lot of thyroid symptoms that get mistaken for Down syndrome symptoms or for, well, that's just Down syndrome. Things like low growth, delayed tooth eruption, constipation, trouble gaining weight. But thyroid also affects the pulmonary system, the lungs. So chronic hypothyroidism or subclinical hypothyroidism makes a person more prone to having respiratory issues, including mucus that they can't clear. There's a correlation between hypothyroidism and the gut. And we know our children oftentimes have issues with the gut. Of course, we know that hypothyroidism has a very strong connection with the brain and with cognition and the ability to learn and memory and focus and concentration. So many times when you're experiencing things with your child, and a doctor says, oh, well, that's just Down syndrome, that can be completely inaccurate. What this actually could be is untreated or improperly treated hypothyroidism. So I hope this video was helpful for you and gives you kind of a thyroid basics 101 and helps you to see the importance of truly pushing for and getting a full thyroid panel to help your child as best as you possibly can. Thank you.